Welcome to Love Thy Neighbor. Today we're meeting with Julie Pryde, Public Health Administrator. We want to thank you for giving us the time today to discuss the vaccination. So how are things going so far?
Well, they're going pretty well. We're up to, let's see the latest stats. I just got to click on my little thing. They change all the time. We're up to, in our county alone, 176,419 doses given with no issues, no serious issues, knock wood. And we have a total of 82,211 people fully vaccinated in our county. So that's the good news. We're moving along. That's 51.39% of our county has had at least one vaccination. Now, we need to see it a lot more than that. And when we break it down, it's not looking that great. Notice how I have to keep looking at all my different charts and graphs everywhere. But the one good thing is that so far, senior 65 and older, we're now at 84.13%. vaccinated. That's good, but everybody who's not vaccinated is still vulnerable. So we need to keep trying to find who's not vaccinated and get them vaccinated. And then African-American and Black community represents about 13.8% of our county population, but have only received about 7.4% of the vaccine. So that needs to at least, we need to get that up there to double at least. Hispanic Latinx community, 6.3% of the population and 4.51% of the vaccine. So those numbers are getting better every day. Every day that we do it, it's getting better, but we need to speed it up because the variants are out there and they are much more contagious.
Wow. Those are some really good stats that you're keeping, and those are key for us to understand how important it is for us to become vaccinated. So why is it so important for us to get vaccinated? We know that they can prevent us from getting illnesses, but some may question, why should I get vaccinated if I may get the illness anyway, and then I have the antibodies developed? So why should we get vaccinated?
So first of all, this COVID, this particular coronavirus, this COVID-19 is very unpredictable. It is kind of all over the place. We're seeing people who are younger having really serious hospitalizations and even deaths. There was just a death this week in Ford County of a young man in high school, junior in high school. And sometimes in children. And although it's rare, it is preventable. So we need to really get those vaccination numbers up. So if you have had COVID, you still need to get vaccinated because that's going to, boost your immunity and prevent it. What a vaccine does is it basically, it gives your body instructions on how to make these proteins so that if you are exposed to the illness, your body immediately can mount a defense against it. So when you get COVID in the wild, if you will, or the natural way, without getting the vaccine, it just gets in your body and it just, takes off. You have nothing there to has ever recognized it because this is what's called a novel virus, meaning that no one on Earth had natural immunity to it. So the vaccines are really important. And because it's such a new one, that's why we need to get the 2 doses. I mean, that's what they did the study, and that gets you up to a really high level of immunity for vaccines. It's a very, very, it's a very effective vaccine. And even though some people, a small number of people can still get COVID, it is not that likely, and it's extremely rare that they have a serious case with it. So that is the important thing.
That is really wonderful to hear because, you hear so much about the vaccination and then having the actual virus itself. And so there are many questions that still exist, even though we see it on television every day and hear so much about it. Which brings to mind the type of education that we need to provide to others regarding the vaccination. How do they come up with the vaccination so fast? I know that's one of the things that's been of concern with some, and that is with it being produced so quickly, how can we trust that this is safe for us?
Yes, and this is something that I think has not been messaged well really anywhere. People who pay attention to this sort of thing all the time because it's their job or because it's just of interest to them knows that these what are called the messenger RNA vaccines, those have been under development for well over 12 years. It is an platform, if you will, for delivering a vaccine. It's a different type of vaccine. So it's not like a killed virus like in a flu shot, or a live virus like a live attenuated virus like are in some. This is a new platform, but it has been being used and studied, for a long time. What the difference is during COVID-19, and they were looking at this for various cancers, for cancer vaccines, but also for, the original SARS that was out there. Remember how deadly that was back in, I think, 2003. But so what happened is when COVID, reared its ugly head, that you've probably heard of, like Operation Warp Speed or whatever they called it. And Bill Gates put a ton of money into it, and all these people put tons of money into it. What that allowed to happen is for all of these different labs to take that architecture, or that platform, if you will, and try to get it inserted in there, the virus, the spike protein information, so that it would work. So these these vaccines platforms have been around, if you will, but they just inserted the new information, and then they had to study it. So even though it seems new to people, it really has still gone through all of the FDA process. And it got something called an emergency use authorization. And the reason why we have that is because if we had to wait the years it takes to get enough people enrolled in a study, and go on years and years, it would we would have had way too many people sick, disabled, and dead from this. So that is the difference. So it was able to get the emergency use authorization. And this is a very important thing that we have. And it came about, we didn't have that before HIV/AIDS. There was no mechanism for that. And that is something that activists fought very hard to get, to say that you need to speed this up. We can't wait while you do your, years and years of study on these things, because people are dying. So it's a very, very good tool. So again, it seems fast, but most people don't pay attention to this stuff in their daily life. So it probably seems fast. But that is part of the goal of, the healthcare system, the public health system, is to have things ready for this. So while there was no vaccine ready, the architecture or platform, or whatever you want to call it, to insert that in. Now, you've probably heard that we may have to have a booster shot at some point, and we could need to have that for two reasons. One would be if the vaccine, if the immunity starts to wane, it starts to get less and less over time. And we already have that with like your tetanus shot. So you know that every 10 years you need to get a tetanus shot. That's because in the tetanus, diphtheria, and pertussis that are in that, it starts to wane. So we get a booster and it gets your immunity back up so that it could recognize if you got it again. The other thing that could happen is that we could have this virus could mutate in such a way, and it's very rapidly mutating virus, just like influenza is. So it could mutate in such a way that it goes past it goes past the ability of the vaccine to work, basically. So, and that would be like a flu shot. So why every year you have to get a new flu shot. And the reason why is because it mutates so much, and they're putting 4 different strains in each vaccine. So Dr. Fauci just said today that he expects probably within a year we may need a booster. But again, that's still guessing. That's really just guessing right now, because they're still, monitoring it. But there have been over 1 billion vaccines given worldwide. And, like I said, we've done 176,419 just in Champaign County alone since the beginning of this.
That's
So,
an excellent perspective. And I'm glad, again, it goes back to the data that you're able to provide, that some people are entrusting that, yes, we need to get this done, and they're being proactive about it, which brings me to to the next question I have. There are 3 vaccinations that are available, and many won't know the difference or are curious as to which one do I need to get, or what's better, or, just a little bit curious about why one over the other. Can you talk a little bit about the vaccinations?
sure. So the Pfizer and the Moderna vaccine are both the vaccines I was just talking about, the messenger RNA. The Johnson & Johnson is a different type of vaccine. It's one that's been around for a lot longer. It's also less effective. They're all, though, highly effective for preventing serious illness or death should you get exposed to COVID. So they're all, very safe and very effective. There are differences, mainly between the Pfizer and the Moderna and Johnson & Johnson. Johnson & Johnson is a 1 dose and then you're done. The other 2 require 2 doses. But right now we have enough vaccine in our community that it's literally your preference. If you haven't been vaccinated yet, you can look at vaccines.gov, and you can look on there and see all the different places in our community, whether it's Walgreens or Walmart or Public Health or Francis Nelson Health Center or Carl or Christie or wherever. You can get the vaccine anywhere, and you can look on there and see what kind they have, and you can choose that one. So I just like to tell people that I would get any of them. I would give my parents or grandparents any of them, and I would give my children any of them, because I would. And it was first available is what I was telling. I told my family, you get the first available.
Yes.
So if your job comes due, you take whatever is out there and get it. So
absolutely.
But now people literally can choose if they want to.
That is wonderful. We know also that there are some common myths that are out there. Can you talk about what those myths have been, and also debunk some of those myths so that we can increase the opportunities for others to come into the center and get their vaccinations?
Yeah. So, okay, I have some actually written down here that we hear a lot. So one is, if I have, the vaccine contains a live virus and it'll make you sick. That is not true. None of the 3 contain a live virus or a live attenuated virus. Vaccine trials did not include Black and brown people. That is not true either. That, historically, yes, that's probably true on various things, because we know that the healthcare system has a long and ugly history. And so does the public health system, frankly, in the United States.
Yes.
But we do know that the trials, it's a different ball game now. So getting vaccines, I don't even know where this one came from, but COVID vaccines can put a microchip into my body. No, that I don't even know where that comes from. It's hard for me to debunk that when that just is not, it's not the case. I have a lot of people who are concerned that they have a lot of allergies or they have certain illnesses and they're afraid to get the vaccine. My suggestion to them, if talking to, me or people that talk about this a lot doesn't make them comfortable, contact your healthcare provider and just say, this is my concern. They are not going to think anything weird about that. I think a lot of people are calling. But I can say that unless you have had a specific, you're specifically allergic to the ingredients in the vaccine, which of course your healthcare provider is going to know what those are, and I can tell you some of those, but they're not really, that unusual of ingredients. They're in all kinds of other things as well. But talk to your healthcare provider, and it's only if you've ever had, something called anaphylaxis. And that means that when you get the vaccine or a bee sting, or you eat peanuts or anything, that you're like hyper allergic to, you can start having the swelling, and your breathing, gets impacted, and it can be very serious.
Yes.
Every single place that is doing the vaccines, just like we do with flu vaccines and just like we do with all of our other vaccines, but every vaccine, the location with COVID has people there trained and ready should anyone experience anaphylaxis. And that means that we have, the medical kits there, the medical providers, and of course we would call 911 as well. So, getting a vaccine is it's a very safe thing. And you only really are worried about that anaphylaxis reaction for about, 15 or 20 minutes. If you're someone that really has a concern, then we're going to tell you at all these sites, you let the person know, and they're going to have you wait an extra 15 minutes just for your own comfort. And they will keep an eye on you that entire time. They will keep eyeballs right on you to make sure that you're comfortable after you get it. But if you have, shellfish allergies or allergies to, pollen or dogs or cats or food or different medicines, you still should get the vaccine. But if you are concerned, specifically talk to your healthcare provider, and they can tell you, or you can look at the specific ingredients and say to your healthcare provider, are any of these of concern for me? Because it's very, very unusual. And like I said, we have given a ton of vaccines in this county already, and 1 billion worldwide. So
that is wonderful.
They are important, though. I mean, we take it seriously when people have those issues, because it is a barrier.
Absolutely, it is. And then finally, one thing that I did want to wrap back around with is you mentioned the numbers for minority populations being low, so Black and brown populations being low in terms of receiving the vaccination. Are there specific outreach that you are doing or attempting, or what exactly is public health doing at this point to promote the vaccination in those communities?
So right now we're going out and doing lots of outreach clinics. We have worked through employers. We have worked through, we have done outreach at job sites, at churches, at parks, we will start doing them at any events out there. And we are in the process, CU Public Health District is working with the U of I. We're going to do some focus groups broken down by race, ethnicity, and age, so that we can find out like who are we needing to reach, and they need to tell us, the people that we talk to, what do we need to do? So we're asking, what can we do to get these numbers up? And it may be, we may be incentivizing it. We may be having specific events. If there's something going on out there, we will be there. We will, if somebody lets us know, we will try to get out there and have clinics. We're also doing, weekend clinics, or there's evening hours. There are, Walgreens and Walmart are open all the time.
Yes.
And there is zero cost for this. If you have insurance, they'll take your insurance, and insurance may get charged, but there is no out-of-pocket cost for this at all. And if you're 12 years and older, you are eligible, period.
Wonderful.
Period. And if you happen to have, you're visiting a grandparent or parent or somebody down here, and you all want to go at the same time and get vaccinated, that's fine. We're not being super strict on the residency requirement or anything. We just want to see people get vaccinated and get safe, and so we can get on with life.
This is one of the first times that I've actually learned there are actual clinics for those that are tourists looking to get the vaccination. So yes, it's very, very important to get the vaccination. I certainly agree to that. Are there any way, how do I get an appointment at the public health department for the vaccination? And are there any opportunities for transportation to help me get to your clinic?
Yes. So, again, they're all over the place. And if you look at vaccines.gov, you can see, I think we looked at it, and there are clinics within like a mile of everyone pretty much in our area. But, public health is on the bus route, and on Fridays we have walk-in clinics. So you don't need an appointment. You can say, it was really rough at the beginning to get appointments all over the place, but that's not the case now. You can literally just walk in someplace, when the clinic's going, and get an appointment. The Dress Barn location that Carl is offering up by the mall, walk in, you can walk in there. Walmart, Walgreens, every place. So once we got over that initial, really big we had very little vaccine and lots and lots of demand. And
Yeah.
now we have way more vaccine than we have demand. So we can open it up and make things much easier for people to get it. But we're on a bus route. Francis Nelson's on the bus route. All the other places are on the bus route. Coming soon, you can get an Uber or Lyft ride for free to get your vaccine. And, you know, we're looking at any and all ideas. One of the things that we've tossed around that, you know, are doing maybe some type of raffle so that people who are, you know, if we're at an event, if you get vaccinated, you can get into a raffle for some, you know, type of prize. And if you bring someone who hasn't been vaccinated, you can also get into the raffle. So, you know, once we talk to people and really dig down and find out what's gonna help, you know, we're gonna do that. So.
That is wonderful. Well, I want to thank you for giving us your time this evening to talk about the vaccinations and also to talk about outreach as well as where to obtain the vaccination. And I'm sure that you and I will be sitting down again to talk about vaccinations and where we are, and hopefully we'll have major progress, especially with Black and Brown communities where you need to see an increase in the numbers.
Mm-hmm.
And thank you.
It's already getting better, and it's because of people like you and shows like this, and all of our amazing community partners that are just doing a great job, and we appreciate it. And if you have great ideas, you know, give us a call. We're open to about anything. So
thank you so much.
Thank
well,
you.
we wish you a good evening and thank you again.
Thank you.
All right. Bye-bye.